So you may have heard of a POLST form, and this stands for Physician-Ordered Life-Sustaining Treatment form. And you might be wondering, do I need one? And what's the difference between that form and an advanced healthcare directive? So let's talk about that. So a POLST form is really interesting. It's in California, and basically it's the do not resuscitate form. It's a bright pink form that you would fill out with your doctor or nurse practitioner or physician assistant. And you say, if you're in cardiac arrest, do you want to be revived or do you want them to just let you go? And then there's a few other details that you can also specify. Then you sign it and your doctor or other healthcare professional signs it as well. Now, what's the purpose of this? So you would put it on your refrigerator, or if you're in a nursing home, they put it at the foot of your bed. It's in a very obvious place. So if you go into cardiac arrest and the EMTs come over to your house, or you're in the skilled nursing facility, the POLST form clearly tells the EMTs whether or not you want to be revived. And if you've checked, do not resuscitate me, then they won't. And it absolves them of liability. So that's how you do a DNR. So let's go through the form a bit so you can see how you can fill it out. Here's the California POLST form. In the top right, you put all of your information. So section A, I think, is the most important section because that talks about whether you want CPR or not. Okay, so you can check yes, attempt resuscitation, or no, do not attempt resuscitation. Now, if you don't have pretty severe health problems and you want to be revived, you don't need a POLST form. They're going to revive you. This is really if you decide you don't want to be revived and you want to make sure, that if you have COPD or dementia, the next time you flatline, you're like, please let me go. That's what section A is for. Section B, so you can say, what type of interventions would you like? You can have full intervention, which includes like intubation, like really invasive treatments. Then you can have just selective treatments where you can say, hey, it's okay if they give me antibiotics and IV fluid, but I don't want anything invasive. And then also just comfort focused, I want pain meds, but I don't want anything else, okay? Because most of us want the pain meds, right? We don't want to be in pain. And then section C is whether you want nutrition and hydration through a tube. How much would you want, for how long, that sort of thing. And then section D is where everybody signs and says, hey, we've reviewed this, we think it's good.
Hey everyone, if you like my mom's video, like and subscribe.
So now how does a POLST form interact with a healthcare directive? So the advanced healthcare directive, which is what we prepare for all of our clients, and there's also forms available online. There's statutory forms. You can fill that out and sign it in front of a notary. And basically that form is where you state what type of healthcare do you want if you're unconscious. So that's really envisioned if you're in a hospital and you're unconscious for a long time, like if you're in a coma, then people have time to sit down and read your healthcare directive, because usually it's several pages, maybe 10 or 12 pages. Whereas with the POLST form, this is just a snap decision. Do you want CPR or not? Now, I found that sections B and C, which we reviewed, those are also covered in the healthcare directive. So if you want them to look at your healthcare directive, because those are more long-term issues that are covered in the healthcare directive, you can cross out sections B and C and just say C healthcare directive. And I think in section D, they also have a section where you can add, where is my healthcare directive? What date did I sign it? Because we really want the POLST form and the healthcare directive to be coordinated. So again, at our office, we do not fill out POLST forms because a doctor or another medical professional needs to sign it to make sure that you really do mean do not resuscitate. But we do help with the healthcare directive and also the HIPAA waivers. And oftentimes the waiver for accessing your healthcare information, oftentimes that's included in the healthcare directive. So I hope this has brought some clarity, and please go ahead and fill out those healthcare directives. Everybody should have one over age 18, and you can also fill out a POLST form, especially if your health is declining and you really want to make sure that people understand your wishes. Thank you.
Hello everyone. If you liked my mom's video, don't forget to like and subscribe. See you all next time.